Dr. Gelrud, you mentioned that in exocrine pancreatic insufficiency, when patients with chronic pancreatitis have this condition, they can develop malnutrition. Can you describe what some signs of malnutrition are in chronic pancreatitis?
Absolutely. That's a very good question, Dr. Phillips. And that also stresses the importance of getting a good history when we're talking to our patients and spending a good quality of time with our patients, particularly at the beginning when we're trying to make a diagnosis. So what's malnutrition when it comes to exocrine pancreatic insufficiency in chronic pancreatitis? So what we hear frequently, particularly at the beginning of the disease, is that they're having a lot of non-specific symptoms that may mimic other medical conditions. That's why the early diagnosis can be a little bit challenging. What are the typical symptoms that we hear? Gas, bloating, rumbling of the GI tract. They eat and soon after they start to get all of these noises. Also, they can develop diarrhea. They can start to develop a little bit of pale looking stool that may float, not necessarily with fat in the stool, but just floaty stool that may be a little bit of full smelling. And I tell patients, stool doesn't smell good, but when you malabsorb fat, it gives a specific or a really bad odor to the stool. So that's something that I like to stress. I also like to ask the patients, if how frequent they're going to the bathroom, among others. So going back to the question of malnutrition, these are very general symptoms. But when they start to tell us that they're losing weight despite eating, that should be a major red flag for the patient, as well as the doctors, that the patient may have exocrine pancreatic insufficiency going into malnutrition. A word of caution also is that when you have exocrine pancreatic insufficiency, you are malabsorbing vitamins. And there's one particular vitamin, which is vitamin D, that may lead to what we call metabolic bone disease, problems with your bones. And something that has been very well established and studied is that patients with exocrine pancreatic insufficiency may develop also vitamin deficiency, may develop weak bones that may lead to bone fractures. So all of these things are very important to keep in mind. And it's important to ask our patients, when you're suspecting that they may have exocrine pancreatic insufficiency. So malnutrition, it's not only weight loss, because the pancreas is not making the enzymes so we can digest all the food, but remember also looking for vitamins. So if your doctor didn't tell you, feel free to remind him or her that this is also important.
And Dr. Gelrud, I might just add that sometimes patients, when they start to lose weight, they lose muscle mass primarily. And so there might not be a huge change in weight, but there's a definite drop in the muscle strength and muscle mass. And so many of these patients may only lose a small amount of weight, but it may still have a very significant clinical implication if they're losing muscle mass, which is a condition called sarcopenia, which these patients also are at high risk for.
That's an excellent point. Totally agree. And the other thing to keep in mind is that sometimes patients start to realize that if they increase the amount of carbohydrate intake, they can compensate for the hunger and they may not necessarily be losing weight. Rarely we see these patients that they may be gaining a little bit of weight, and it may be just that they're compensating with sugars, that you don't really need a completely normal working pancreas to absorb them. So that's a very good point, and it's also something to keep in mind.